We reported from yesterday, so we reported this morning, 24 locally acquired cases of COVID-19. Of these, 20 cases are linked to known outbreaks, and 18 of the 24 have been in isolation for the entirety of their infectious period. Jerome will run through the details shortly. Of the current outbreak, we currently have 12 people in hospital and we have 2 people in ICU, and we extend our sympathy and support to those people. Neither are ventilated, but we also thank our hard-working frontline healthcare workers for the great work they do in supporting people in hospital. Of the 246 active cases that we currently have in Victoria, 56 are aged under the age of 9 years old, and 55 are aged between 10 and 19. Yesterday, we administered 27,123 vaccines in our state-run clinics, and an even higher number through our GPs and primary healthcare providers, and that was pleasing to see. In our state-run clinics, we've now passed more than 2 million doses administered by our teams in those locations. I want to thank all those Victorians for coming forward and getting tested. And we've seen over 4 million right across the state from all platforms of delivery. Yesterday, we also saw 39,832 COVID tests, and I'm very pleased to see that those numbers are increasing, but there's more to be done in that area, and I'll touch on that very shortly. And I'm also pleased to see that we've expanded the testing capacity, particularly in the City of Port Phillip and City of Glen Eira areas, especially in the St Kilda East, Caulfield areas of those two, or one location really. Today, a drive-through and walk-up testing centre has been established at the St Kilda Palais car park. It opened this morning, it's open now, and it will continue operating for as long as it needs to into the future. It's open from 9 a.m. to 5 p.m. From here on in. It's both a drive-in and a walk-in centre for people in that community. But it's just one option in that space of the inner south. There's the Brighton Golf Club, there's the facility at the Albert Park Reserve next to, in behind the pit buildings, there's the Alfred Hospital, there's the Paran Town Hall, there's Golfers Drive in East Malvern, and there's others. So I'd encourage anyone in that part of town just to hop online and look at where your nearest testing options are, and keep an eye on the demand levels that can allow you, for instance, as I know from direct experience, sometimes in that community it's quicker to go to the showgrounds. I can assure you from direct experience that that's been the case. And the showgrounds is a very large site, very efficient, and not to be ruled out as an option. It might well save you long time waits. And of course, travelling for vaccinations is one of the approved reasons for leaving your 5-kilometre restricted areas. So please visit coronavirus.vic.gov.au to see all the wait live times and make an appropriate decision. There is nothing more important in this current climate than making sure our contact tracers and our public health teams stay ahead of the virus, and that comes from better testing numbers. And particularly in the areas where we've got a strong focus, we want to make sure that our testing numbers are up. Not just in those areas. If you show any signs of COVID-19 with such low levels of general flu symptoms and cold symptoms, if you show any symptoms, work on the basis that it's COVID, come forward and please get tested. I just want to particularly refer to the St Kilda, East St Kilda, Caulfield community. That's facing some challenges at the moment, and we'll go through those challenges. We've been monitoring those growing numbers in recent days, whether, as we indicated yesterday, whether it's not linked by occupation, it's not linked by footy clubs, not linked by faith, it's linked by geography. And it's a rich and a diverse community, and one that I know pretty well. And it's a community that has always had a really strong community ethos of standing up when it counts, and now is one of those times. And we know that every case is different, and that every case can be complex, and many cases can be linked in sensitive settings, and we have systems in place to take account of each of those particular settings. I can confirm that the reports that one of the positive cases in recent days is a sex worker, and I can also confirm that that person is safely quarantining and is under the best possible care. So we need to deal with that issue, as we deal with all issues, respectfully and carefully. We're working with that individual, and their privacy is assured. I stress there is no evidence of transmission having occurred because of this person's sex work occupation, but out of caution, we are asking that if you have employed a sex worker in the St Kilda area, you need to come forward and get tested. And no matter where you are, you need to come forward and get tested. We are working with our partners, particularly in the local community health sector, who are doing an outstanding job on the ground in working with some of the vulnerable community members in that setting, particularly through the place where the person lives and other arrangements in that pretty diverse St Kilda community. Just like we're working through with the faith communities in that part of town and other parts of that community. This is an outbreak that is defined by geography and stretches from one end, Middle Park, all the way through to Caulfield North. And what we have to do is run it down by high levels of testing and at the same time, deep engagement with each of the communities in that part of town. I can add that we've already tested a number of the close primary contacts of this person, and I'm pleased to report that all of those tests that have so far come back in are negative. But to be clear, this is an outbreak not of a particular part of that rich, diverse community. It's an outbreak that has reached across the different geographic parts of, essentially from Middle Park at one end to Caulfield North at the other. And we want to make sure that issues of what faith you follow, what profession you're involved with, what your arrangements are, in what your form of housing is, that the issue here is that this virus does not discriminate on the basis of those factors. It targets out anyone it can get its grips into. And what I'm calling for in this community is for people to come forward and get tested. It's the most important thing you can do to help our community stay ahead of this outbreak. More broadly, on testing, testing is important no matter where you are in Victoria, no matter what your background is, no matter what your community that you're a part of. So that's why today we're launching a new advertising campaign encouraging Victorians to see that if their possible cold symptoms might not just be a cold symptoms, it might be COVID-19 symptoms. In fact, given the low levels of other forms of illness in the community, there's every chance it is. So you need to come forward and get tested no matter what those symptoms are. So what we want to do is drive up testing numbers right across the state. The new campaign, Only a Test Can Tell, will launch across all media platforms in the coming days, including on television and radio networks today. It will run for as long as it's needed, and I'm sure it will help build up the numbers of Victorians who come forward and get tested. We say time and time again, because it's true, if you have even the most slight of symptoms, or if you've been to an exposure site, or you're a contact in a primary or secondary, you need to come forward and get tested. It's the most important thing you can do. But if you just think you've got a cold, it might well be the inadvertent spreading of COVID-19. And given the weather in Melbourne during winter, we know that people might well need to be tested on multiple occasions as we get through this winter and autumn period. Only a test can tell if your runny nose is really a COVID-19 runny nose. If you've got a cough, only a test can tell if that is a COVID-19 cough. And if you've got a fever, only a COVID-19 test will tell you if that is a COVID-19 fever. The earliest you get tested, the earliest that you get a response back is the way in which you can help us all stay ahead of this outbreak. An early positive test, should you get it, means that you can take action to protect yourself and protect your family and protect your community. If you get a negative test, that's even better. That gives you and your family the reassurance that you need to then take the next steps in your community. The negative test is that ultimate reassurance.